Hello friends, welcome again, with the topic of Pharmaceutics Part 1. In this video we are going to study about the suppositories. So let's start. Contents to be covered in this video are definition, advantages, disadvantages and types of suppository. First let's see what is suppository. A suppository is a medication delivery system that is inserted into the body through the rectum, vagina, or urethra. It is designed to release the active ingredients of the medication and provide localized or systemic effects. Here are some advantages and disadvantages of suppositories. Advantages. First, targeted delivery. Suppositories offer a localized route of administration, which can be advantageous for conditions that require direct treatment to the rectal, vaginal, or urethral areas. Second, bypassing first-pass metabolism. When a medication is taken orally, it passes through the liver before entering the bloodstream, which can result in a reduction of the drug's potency due to metabolism. Suppositories can bypass the liver's first-pass effect, leading to a more direct and potent therapeutic effect. Third, useful when oral administration is not feasible. Suppositories can be beneficial when a patient is unable to take medications orally, for example, due to vomiting or difficulty swallowing. Fourth, steady drug release. Suppositories can provide a controlled and sustained release of medication over time, leading to prolonged therapeutic effects. Fifth, emergency administration. Suppositories can be used when a rapid onset of action is required, as they can quickly dissolve and start releasing the medication. Sixth, reduced gastric irritation. Some medications can irritate the stomach lining when taken orally. Suppositories can help bypass the gastrointestinal tract and reduce the risk of irritation. Disadvantages. First, discomfort or embarrassment. Inserting a suppository can be uncomfortable or embarrassing for some individuals, particularly when used in the rectal or vaginal route. Second, limited drug choices. Not all medications are available in suppository form, limiting the range of drugs that can be administered through this route. Third, inconsistent absorption. Absorption of medication from suppositories can be less predictable compared to other routes, which can lead to variations in effectiveness. Fourth, leakage or expulsion. There is a possibility that a suppository might be expelled from the body before it fully dissolves, reducing the amount of medication absorbed. Fifth, irritation or allergic reactions. Some individuals may experience irritation or allergic reactions in response to the suppository's ingredients. Sixth, limited site of action. Suppositories are generally designed for localized effects, so they may not be suitable for medications that need to act systemically. Seventh, hygiene and cleanliness. Proper hygiene is essential when using suppositories to prevent infection or contamination. Now the next is types of suppository. Suppositories come in different types, each designed for specific routes of administration and intended effects. Here are some common types of suppositories along with examples. First, rectal suppositories. Rectal suppositories are inserted into the rectum and are commonly used for local or systemic effects. They can contain various medications, such as A. Glycerin suppositories, used as a mild laxative to relieve constipation. B. Bisacodyl suppositories, another type of laxative used to stimulate bowel movements. C. Acetaminophen suppositories, used for pain relief and fever reduction. D. Mesalamine suppositories, used to treat inflammation in the rectum and lower colon, as in cases of ulcerative colitis. Rectal suppositories are often prepared using a fatty or water-soluble base. The base can include mixtures of cocoa butter, hydrogenated vegetable oils, and other excipients. The active ingredient is typically blended into the base in specific proportions and melted together. The mixture is then poured into suppository molds and allowed to solidify. Once solidified, the suppositories are removed from the molds and packaged. Second, vaginal suppositories. Vaginal suppositories are inserted into the vagina and are often used for localized effects, such as treating infections or hormonal imbalances. Examples include A. Antifungal vaginal suppositories, used to treat vaginal yeast infections. Clotrimazole and miconazole are common active ingredients. B. Hormonal vaginal suppositories. Some forms of hormone replacement therapy in contraception can be administered via vaginal suppositories. Vaginal suppositories can have a base that is either water-soluble or fatty, depending on the desired effect. For example, antifungal vaginal suppositories often use a water-soluble base to ensure rapid dissolution in the vaginal environment. The preparation process is similar to rectal suppositories, involving melting the base, incorporating the active ingredient, pouring into molds, and allowing them to solidify. Third, urethral suppositories. Urethral suppositories are inserted into the urethra and are typically used to treat conditions related to the urinary tract. One example is alprostadil urethral suppositories, used to treat erectile dysfunction by increasing blood flow to the penis. Urethral suppositories are typically designed to dissolve quickly upon insertion. They often contain medications to treat erectile dysfunction or other urological conditions. The formulation may include water-soluble polymers and active ingredients. These suppositories need to be properly formulated to ensure comfort and ease of insertion. Fourth, nasal suppositories. Nasal suppositories are inserted into the nostrils and are used for localized effects in the nasal passages. One example is nasal decongestant suppositories. These can contain active ingredients like eucalyptus oil or menthol to provide relief from nasal congestion. Nasal suppositories, also known as nasal sticks or inhalant sticks, are inserted into the nostrils for localized effects. The base may contain ingredients like menthol or eucalyptus oil for decongestion. These suppositories are formulated to provide a gradual release of the active ingredients when exposed to the warmth and moisture of the nasal passages. Fifth, rectovaginal suppositories. Rectovaginal suppositories are designed to be inserted into both the rectum and the vagina. They can be used for combined local and systemic effects. Example, progesterone rectovaginal suppositories, used in hormone therapy for fertility treatments or managing certain gynecological conditions. Rectovaginal suppositories are prepared by combining ingredients suitable for both vaginal and rectal administration. The formulation will depend on the specific medical purpose, such as hormone therapy or fertility treatments. Sixth, hemorrhoidal suppositories. Hemorrhoidal suppositories are specifically designed to treat hemorrhoids, which are swollen and inflamed blood vessels in the rectum or anus. Example, hydrocortisone hemorrhoidal suppositories, used to reduce itching, inflammation, and discomfort associated with hemorrhoids. Hemorrhoidal suppositories are formulated to relieve discomfort and inflammation associated with hemorrhoids. They may contain ingredients like hydrocortisone or astringents. The base used can vary, but it's often designed to melt or dissolve at body temperature for ease of insertion and drug release. Note, these are just few examples of suppository available. Thank you for watching this video. In the next video we will continue the topic. If our videos were helping you, then please kindly subscribe the channel. Thank you.